If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? In other words, Obamacare is creating right now a nation of pre-existing conditions. Now, many say they're being helped by Democrat health care, including, no doubt, many at this table will say so later. But as the Democrats help you, because they're helping you, they are harming you permanently for the rest of your life. If any of us ever get sick under Obamacare, you have a pre-existing condition for the rest of your life. So my firm recommendation is that if you are on Obamacare now, get out while you can.
Our first witness is Mr. Christopher Briggs. He is the Publications and Public Affairs Counsel at the Independent Institute. He received his Bachelor's of Arts in History and English from Bowdoin College and holds a Master of Arts in Political Theory from Catholic University. Mr. Briggs.
Chairman Johnson and Ranking Member Blumenthal and members of the U.S. Permanent Subcommittee on Investigations, please allow me to thank you for the opportunity to testify before you today about the harm Obamacare inflicts on the American people. And I just have to say, this is the first time I've had a chance to sit in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? In November 2015, my wife got the most dreadful call a parent can get. The doctor knew why our youngest daughter, Colette, hadn't been feeling well. Blood work had revealed leukemia. So we raced Colette to Inova Fairfax Hospital, the only one in Northern Virginia that treats pediatric cancer, and got there just in time. Now, thanks to Obamacare, we were already in difficult straits regarding health care. Before the ACA went into effect, the market had offered us a wide variety of relatively inexpensive plans that covered specialist care, even out of state. After the ACA, however, all that was left were increasingly costly plans with fewer benefits, including fewer doctors and fewer hospitals. Thanks to the ACA, we were basically restricted to the medical facilities within a short distance of our zip code. The healthcare experts among us will talk about narrow networks. That doesn't even begin to describe the horror. Obamacare made us into medical serfs. We are tied to the land, unable to leave it, even to save a little girl battling cancer, which is why, when we tried to take our daughter Colette to Johns Hopkins up the road in Baltimore, we were denied. Under our pre-ACA plan, which didn't geofence sick children from the care that they deserve, she would have been admitted. Now, our predicament was made even more painful by swelling premiums and skyrocketing deductible and maximum out-of-pocket expenses. Pre-ACA, our monthly premiums were about $800 per month, and the maximum back-end expenses was about $3,500, give or take. After the ACA went into effect, our monthly premiums, and this is with subsidies, went to nearly $2,000 per month. Annual deductible and maximum out-of-pocket expenses with subsidies, $20,000 a month, or nearly. And thanks to cancer, which my daughter came down with, we hit those maximums many, many times. So think about that. In the 10 years since the Democrats inflicted Obama's health care plan on us, we had to pay for many, many years, almost $50,000 annually in insurance payments and medical bills. And that was money we did not have. No middle-class family can endure that kind of expense. The upshot of our decade of affordable health care under Obamacare, our savings are gone. And we have virtually nothing left to retire on. And to handle the remaining debt, we are beginning the process of taking out a home equity loan. And this is the subsidized affordability that the Democrats today insist Congress perpetuate. Now, in those dark early days of cancer, when my daughter was first diagnosed, things got much worse than expensive. In 2018, Obamacare literally offered us no plan in our zip code for any amount of money that we could buy that covered Colette's treatment at the one pediatric cancer ward in Northern Virginia, in Inova Fairfax. So under Obamacare in 2018, our daughter was effectively without coverage for cancer, not a common cold or a broken bone, but cancer. What kind of health care plan did the Democrats inflict on us that it can't handle childhood cancer? And we went through another terrifying event in 2020. Now, with COVID sweeping the country in mid-March, the plan we had that year announced that in 2 weeks, it would no longer cover my daughter's clinic, where she received a lot of her chemotherapy. So once again, thanks to the ACA, we were left without coverage for our daughter recovering from cancer. And in both cases, we had to appeal to the author of our problems, to the government, to all of you. And fortunately, I was able to persuade, threaten, Senator Warner's staff to bully, in both cases, an insurance giant back into the marketplace. Now, perhaps to solve the instability inherent in Obamacare, the government could just take over all medical facilities, but then everybody in the country would be at the mercy of the same government bureaucracy that has been brutalizing my daughter and her parents for years. Under single payer, we would have not the circumstantial cancellation of coverage that comes with the socialization of insurance products, but we would have dying in line waiting for care, such as they have in UK or closer to home at the Veterans Administration. In those institutions, the scarcity that we experienced is no longer circumstantial, but deliberately meted out to patients as lethal policy. We watched as the institutions of medicine under Obamacare colluded with a disease against our daughter, and that would be a daily occurrence under single payer for every American who's under it. Now, there's one more harm that Obamacare is inflicting on millions of Americans, and this one is quite hidden, but it is massive in scale. Obamacare is not insurance, but a scheme, some would say, I would say, a Ponzi scheme to pay for medical bills. And since my daughter got very sick under a non-insurance regime, she is now permanently uninsurable. And why is that? It is impossible to buy car insurance after an accident. My daughter has had that accident, and she is permanently uninsurable as a result. So if we ever restore real insurance to this country, and we're going to have to, because what we have now is unstable and will collapse on its own. And single payer is a disaster. My daughter will never be able to have one of those plans. Now, if I had been allowed to keep my pre-CA plan, as President Obama promised, my daughter today and forever, for the rest of her life, would have ensured durable access to medical care. So in essence, Obamacare turned an insurable illness, even one as grave as cancer, into a permanent pre-existing condition from which my daughter will never escape. But my daughter is not alone. Millions of persons have gotten seriously sick under Obamacare, and more will do so every year. In other words, Obamacare is creating right now a nation of pre-existing conditions. Now, many say they're being helped by Democrat health care, including, no doubt, many at this table will say so later. But as the Democrats help you, because they're helping you, they are harming you permanently for the rest of your life. If any of us ever get sick under Obamacare, you have a pre-existing condition for the rest of your life. So my firm recommendation is that if you are on Obamacare now, get out while you can. And I am asking that this body and the House and the President provide us a way out. There's one correct long-term answer, and that's repeal Obamacare and replace it, not with another planned economy in health insurance, or God forbid, a planned economy in medicine itself. The idea of a plan is the problem. What plan created the iPhone? We should sell insurance the same way. We need to repeal Obamacare and then set up not single payer, but as my colleague at the Independent Institute, who's our president, Graham Walker, has said, what we need is single market across state lines in which millions of Americans can buy real, actuarially sound, automatically renewable insurance products curated to individual needs.